Hey guys, what is up? My name is MastaC and welcome to Mental MastaC.
Caution. MastaC is not a doctor and bases all his information off of personal experience and/or research. Do not make any decisions about your health without discussing it with your doctor first. Otherwise, grab your Prozac, share this video with a friend, and let's begin to change the negative stigmas attached to all mental illnesses.
Today we're going to be going over a very interesting topic, something that if you don't quite understand how it works, it can be very scary. I've been going through this for probably 2, maybe 3 months now, and I don't really see a big increase with helping my mental illness, but I'm still going to give it a try because I'm hoping that one of these times something's going to snap and things are going to fall into place. Now, of course, I am talking about ECT, also known as Electroconvulsive Therapy, Electroconvulsive Therapy. For those of you who don't know what that is shock therapy. So back in the olden days, they would put the 2 paddles on the side of your head and shock you and you would convulse non-stop. Now today, it is a very different procedure. I'm going to actually walk you through that procedure of what I do every time I go in to get one of these electroconvulsive therapy treatments done. Now, ECT is considered the gold standard whenever it comes to treating depression. It's supposed to be about 90% successful. I'm not quite sure if I believe that or not, because a lot of the people that I have talked to who do it with me, my fellow patients who go in and I see them on a regular basis, I don't really see a big improvement in them, but who knows, maybe they have an improvement whenever they're at home, maybe just whenever they're at the office they act a little bit different. So, first off, I'm going to say I'm not a doctor. You guys know that. I put that caution disclaimer out there for a reason. This is just my personal experience with ECT and kind of what I go through. Now, I'm not sure, first of all, if ECT helps with other mental illnesses besides depression, but I don't know. That's something you might want to ask your doctor if you're suffering from like anxiety or bipolar or schizophrenia or any of the other mental illnesses. It might be worth a shot to ask your doctor. Now, I'm going to tell you something that's a little bit scary about the electroconvulsive therapy. It's technically an electric lobotomy. Now, for those of you who do know what a lobotomy is, that's awful scary. So, I'm going to tell you what a lobotomy is right now, what it does. It consists of cutting or scraping away most of the connections to and from the prefrontal cortex, the anterior part of the frontal lobes of the brain. So back in the olden days, in the 1940s and 1950s, doctors would go in and they would scrape away part of your brain. Now, ECT is actually considered an electric lobotomy. It's obviously not getting rid of parts of your brain, but it is damaging them to try to fix this mental illness for you. So it's a very severe treatment. It's usually used as a last result if antidepressants or any other medications such as antipsychotics are not working. So here we go, folks. I hope you're ready for the entire process because I'm going to walk you through step by step kind of what happens if you're curious. So if you know someone who is really struggling out there, if they're having suicidal thoughts, if they've been inpatient places and it just hasn't worked, direct them to this video. Let them know that there is another treatment out there. It's a little bit more extreme, but if they're willing to give it a shot, it could work. Obviously, I'm saying do this as a last result, but always talk to your doctor first. So, for my treatments, I always arrive early. I arrive about an hour early. I go in there into the back room where the nurses are, sign my life away. I sign like 4 or 5 papers, probably 6 or 7 different signatures and dates, and putting my date of birth, all saying that if something happens, they're not liable, and blah, 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 keeping track of how many treatments I've done. And then the nurses are going to ask me a couple questions. They ask me, have you had anything to eat or drink since midnight? Because you're not allowed to, because they're going to use anesthesia. And if you eat or drink after midnight, if you've never had surgery, you have the chance of throwing up. And if you do that during treatment, there's a good chance that you're going to choke. So they don't want you to eat or drink anything after midnight. You're not allowed to have any medication after midnight unless it's for pain. So they're going to ask you, have you had any medication? And then they're going to ask you, are you in any pain? So those are the 3 questions. And I do need to correct something. You are allowed to take medication for, I think it's blood pressure and for pain. So I did say pain, but also blood pressure as well. Now, once I do that, I usually go back into the waiting room until they call me. Whenever they call me, I'm going to get in one of the hospital beds that they have there. They usually have about 5 hospital beds set up. And they're going to hook me up with an IV. And I just kind of sit there and wait and ponder and, think about kind of what's going to come next. And then whenever it's my turn, they wheel me through the double doors into the treatment room, and that's where I actually begin the treatment with the doctor. Now, the doctor that I have is absolutely amazing. Definitely my favorite doctor of all time. He's very intelligent. When I did the consultation with him, we talked for probably 45 minutes to an hour, and he answered every question that I have, so I feel super comfortable with him. Now, when you check in with him, he asks, how do you feel? You kind of fill him in if anything happens. So next time I see him, I'm going to have to kind of tell him about the suicide attempt and, what was going through my mind and if I feel comfortable doing the ECT or if he feels like I need to go inpatient. So I'm going to have to talk to him about that. He's going to ask if I've had any change since I did the last treatment. He asks every time if I think that it's working or if I think that things have become stagnant. He's going to ask that as well. And then recently he started to recommend that I try different medications. So since I like him so much and I find him so intelligent, I definitely want to take his recommendations. So today I'm actually going to go see my psychiatrist and try to get on those medications that the ECT doctor recommended. Excuse me, I can't talk right now. Because I feel like he's very intelligent and I've been wanting to get on those medicines for a couple years now. So he just hit the nail right on the head whenever he said that. So, what comes next is you're going to perform a timeout with one of the nurses who is helping with the procedures. She's going to ask for your name. She's going to ask for your date of birth. She's going to ask, what are you here for? And for me, I answer ECT. And then she's going to say with, and then I say doctor, and then I give his name. So, that's the whole check-in. During all that time, the anesthesiologist is getting the propofol ready, she's getting the muscle relaxers ready, and they're also hooking you up with some sensors so they can monitor your heart, monitor obviously your blood pressure, your pulse ox, and then they put some sensors on your forehead and behind your ear so they can monitor your brain activity for the actual treatment. So next starts the actual treatment. The anesthesiologist is going to give you a muscle relaxer, and it definitely helps calm you down a little bit. And then they're going to put an oxygen mask on you because they give you oxygen throughout the entire treatment. Obviously, you take deep breaths like you're going into surgery because they want that oxygen to be pulsing through your body as much as possible. Then the propofol gets injected. This is when things start to actually happen. For me, the propofol usually takes about 10 seconds to kick in, and then I am out like a light. Before I know it, I have woken up in the recovery room. Now, the propofol, once she puts it in, it's a very weird feeling. For me, it's kind of like a burning feeling. It's actually very relaxing for me. Maybe just because I've done it so many times and I know kind of that it's going to help me ease into a sleep, but it's definitely nothing to be afraid of, but it is what they use for surgery, so it is a little bit intense. And the last thing that I remember before I actually fall asleep, whenever the propofol is starting to course through my veins, is that I can hear the doctor over to my right side, and he's squeezing gel onto the paddles that he uses to actually do the shock. Now, I assume that this gel is to help get good conductivity to the skin, so there's not like any, it's not attached or it's not touching your skin in certain places. They want it to be a full contact shock. And for the shock, they use 450 volts DC, which sounds like a lot, but it's really not that much. It powers, I think, like a regular light bulb for maybe 6 seconds, so it's not that much, but it is enough to induce a seizure. And during that time, the doctor is going to monitor your brain activity and make sure that everything is going well. And if he feels that the actual treatment was insufficient the first time, he has told me that he has administered a second shock on me before to get the brain activity that he was looking for. So that's a little intense whenever he tells me that he's done, 2 shocks in one treatment. But he is the doctor. I do trust him. He knows what he's doing, so I feel like I'm in good hands with that. Also, I'm going to tell you the anesthesiologist that I usually go see, she is amazing. She's perfect, very friendly, and she's just very calming. Everyone in there is just very calming, so I can't complain about the actual treatment. Now, these shocks, they do damage certain parts of the brain. Like I said, it's kind of like the electric lobotomy, and that's just because it's trying to fix the mental illness. But for me, I don't have very many side effects, no loss of intellect and no loss of personality, but even though recently my personality has been very subpar, it's been very down, I've been feeling like I'm dragging, and I've just been anxious through the roof, like 7 to 10 every single day. So hanging in there, but hopefully my next treatment that I have for ECT, it's going to be a little bit more successful. So whenever I did ECT, whenever I first started, they started with unilateral treatment. Now, unilateral is where they only shock one side of the brain, so they'll put a paddle here, and then they'll put a paddle actually on the top of your head, so the current can run through, and it that way is a little bit safer. There's usually less memory loss. It's not quite as intense, so you don't feel so drained throughout the whole day. I probably did that for about 7, maybe 8 treatments, and then the doctor decided that I needed to switch to bilateral because I wasn't responding to unilateral. Now, bilateral is like back in the olden days, what you would see is they attach paddles to both sides, they induce the shock, and the current's going to travel straight through your brain and then induce a seizure that way. Now, this is a much more aggressive treatment, has much more side effects such as memory loss, making you feel more exhausted throughout the day, and just making you have this overall weird feeling throughout the rest of the day as well. So when I wake up, I feel very out of it. I feel very messed up, very confused. Usually I'm very confused on where I'm at, even though I'm laying in the hospital bed, still getting my vitals checked, still getting my pulse ox, and, I'm with the nurses and stuff. And actually last time during my treatment, it might have been one of the times where we had to do 2 shocks because when I woke up I had an oxygen mask on. I guess they had to give me oxygen because my pulse ox dropped down to like 90, maybe 91 whenever I was sleeping. So it's a little bit scary as well. I'm not a big fan of that. That was the first time and hopefully the only time. And like I said, they're going to be checking your vitals after the treatment's done. So that pretty much concludes the whole treatment. They're going to check your vitals. They do 3 sets for me. And after that, they're going to allow you to have, something to eat, something to drink. For me, since I do the bilateral and it's much more aggressive, I don't want any food. I don't want any water, just because my throat and everything just feels so tense and so weird, and I'm not a big fan. I get a very dry mouth. I can't eat anything for probably 4 or 5 hours unless it is soaking wet. So later in the day, my big meal on ECT days is pancakes. Yay! So I have my mother make me some pancakes. I drench them in some syrup, and I just go to town and I just eat pancakes, because usually that's about 5 o'clock at night, and I haven't eaten anything for probably 24, almost 30 hours. So at that point, I'm usually starving. Also, when I wake up, I am usually very grouchy, and usually you're in the recovery room for maybe 10 to 15 minutes, so that's not very long to actually be there. Obviously, you're not allowed to drive since you were under anesthesia and you just had a major, kind of treatment done. So I have to have my mother come back and pick me up. So whenever I wake up, actually it's before I go in, I'll send her a text saying I'm going in. You can come in, 15 minutes. And then whenever she's there, she'll just pick me up and we'll just leave. So that concludes the whole treatment for ECT. Now, I know it's a little bit intense, the unilateral to the bilateral, and, the actual voltage, 450 volts of DC, and, all that information, actually getting anesthesia. I know it's a little bit intense, but going through the actual treatment is a piece of cake. It feels like nothing. It's very quick, very easy. Just the recovery for the rest of the day is the part that I really struggle with. Now we're going to go into something else that's affects me a little bit more is the side effects. So since I switched to bilateral, side effects have become much more prevalent than they were with unilateral. With bilateral, I get very dry mouth, like I said, aching muscles all over, headaches, obviously, since they were running currents through your brain. With the bilateral, the memory loss has increased substantially more than it was with the unilateral. Like I said, sometimes I'll wake up and I'll be like, where am I? Didn't even know that I was doing treatment. I'll forget stuff that I said yesterday. I'll forget stuff that I say the same day of. So memory loss is one of the big things that you get with ECT. So if you do decide to do this treatment as a last result, just expect maybe some short-term memory loss. I haven't had any long-term memory loss, which is excellent so far. Also, I have agitation when I wake up, loss of energy, I just feel drained, and loss of appetite. Now, my treatments when I started, they were done Monday, Wednesday, Friday, and I did that for probably a month. And then after that, they dropped to once a week. So I would go in either Monday, either Wednesday, or either Friday. And eventually, after I get, to a more stable point, they're going to go to once a month. So that'll be nice. I won't have to be going there every single week and getting put under and, kind of throwing off my whole couple days. So that'll be nice once it's once a month. Now, recently, how I feel about ECT. Feel a little disappointed that it hasn't worked yet, because once again, I've done 18 treatments. I have my 19th treatment this coming Monday. I was supposed to have it today, but I couldn't have it because of my stitches. I didn't feel comfortable, convulsing and tensing up everything with these stitches. I didn't want to rip my sutures. So I'm going to have it on Monday, and I'm just hoping that one of these treatments is something's going to click. I don't know how many the doctor is allowed to do. He mentioned something around 20, and I'm already at 18, so we're going to see what he has to say next time I go in to see him. Once again, I don't have any loss of personality or intellect, and if you are stuck, if someone you know is very stuck, it is definitely worth it. But once again, I am not a doctor. This is my own personal experience, but I am saying it's worth it to give it a shot because it doesn't hurt, it's very painless, and it's supposed to be the gold standard of about a 90% success rate. So if you are stuck, if you know someone who is stuck, mention it to them. Have them do some research on it, ask their PCP, ask your psychiatrist. Maybe that's the solution for you. That's why I'm making this video, is to educate people on the whole process of what ECT has become. Because it's not scary like it used to be. It's not, you get shocked while you're awake and you're biting down and you're biting your tongue off and you're just shaking all over the place. No, it's not like that anymore. You're completely knocked out. They put bite guards in. It's a very safe procedure nowadays. So I just wanted to educate people on what electroconvulsive therapy has become. So I do appreciate you guys for sticking around. If you watch this because you are struggling, I do hope that you get the help that you need. If you watch this just because you were interested to see kind of what the procedure was like, what happened, kind of what happened during that 20 minutes of the treatment, then I hope that you learned something interesting as well. But thank you guys so much for watching. I do hope that you learned something interesting. If you're struggling, just know that I love you. I'm here for you if you ever need to talk. Just hit me up in the comments or on my Facebook, my Twitter, or my Patreon. Speaking about Patreon, those bottles that scroll down at the end of the video, you can actually get your name put on those bottles if you donate to the Patreon. All you have to do is click the $10 reward, and you're going to get your name put on each bottle. So, or not each bottle, but on a bottle, and it'll scroll up at the end of every video for that entire month. So that's something that you might want to look into if you're enjoying these videos and if you really want to support me. Do hope that you guys enjoyed. Thank you for watching, and once again, thank you, and keep your chins up.